All right, hello and welcome everyone to today's presentation. My name is Jacob Borkover here on the webinar team at Rectangle Health, and just want to take the time to thank everyone for being here today. We've got a great presentation for you in store. We're going to learn about all things HIPAA compliance. So before we get into things here, a few quick housekeeping notes. This is a 1.5 hour, 1.5 CE credit course. We are PACE accredited through AGD to provide CE. So we will be sending out your CE credits within 2 weeks of the presentation. So be on the lookout in your email for that. If you are joining us today from a mobile device and you can get to a desktop, we do recommend doing so. It is a better viewing experience and it will be easier to answer the polling questions. We will have 3 polling questions throughout the presentation. That's our way to make sure you're here and engaging and learning the subject matter so that we can continue to keep our accreditation and provide you with the best CE. After the webinar, you're going to have a brief survey that's going to pop up onto your screen. If you could fill that out, that would be greatly appreciated so we can continue to expand our webinar program and make sure we're providing you with the best content. And then there's going to be a few resources that are discussed during the presentation. All those links are going to go in the chat so you have access to them. And then you will be receiving a follow-up email within 24 hours of the presentation. That's going to have a link to the slides, the recording in case anyone from your staff couldn't make it, as long as some other resources as well. So be on the lookout in your email for that. And then if you have any questions at all, feel free to put them in the chat. We also have a support email available for you that I'll also put in the chat bar as well in case you need any assistance. So looking forward to this today. And with that, I'm excited to pass it along to our speaker, Terry McDonald. He's the Director of Compliance Solutions here at Rectangle Health and is considered a leader in the compliance field. He focuses on providing HIPAA, OSHA, PCI, and payment solutions to thousands of medical and dental practices all across America. So he is a top industry leader when it comes to compliance. Not many people know more than Terry. So with that, Terry, I'm going to send it into you.
Thank you, Jacob. Wow, you really set a high bar for me every time. So thank you for doing that. It makes me step my game up and make sure that I'm on for the next 90 minutes because I have to live up to that introduction. So thank you, Jacob. Hello, everyone across America. Here is your favorite hour and a half, which is HIPAA compliance. So my goal here, broadcasting live from Las Vegas, is to make sure that, A, you don't fall asleep. But normally, yes, I know HIPAA compliance is not the most fun or sexy thing out there, but I do want to make sure all of you leave with useful information. I want you to make sure you leave here saying, that was one of the best hour and a half on HIPAA I've ever had. I'm in a better place because of it. For those of you who are attending just for the CE and that's it, I want to make sure you are more educated. You can take that back, practice in safe habits at your practice. For those of you out there who are in charge of compliance, you're that certified compliance officer. You're here to make sure your practice is doing everything the right way. You're going to absolutely love this. I'm going to cover a lot of things HIPAA, give you a lot of great examples of the right way to do things. And I'll also be pointing out a lot of the mistakes and common pitfalls of practices across America. So very excited to dive into this information. Seems like it's going to be a long time, that 90 minutes, but it flies by. And I see people jumping in here. Even just since we've started, we have another 80 people join just during Jacob's amazing introduction. For those 80 people, I'm going to tell you this right out the gate that I know you're wondering. Jacob just said it, but we're going to get you your CE, of course. Usually we're pretty quick with it. We turn around within a day or two. We like to have a little cushion. We say at most 2 weeks, and that CE will be sent to the email that you used for registration. So remember that whatever you registered for this webinar is where we have to send it. Please make sure you attend the whole 90 minutes. Obviously, part of accreditation is we have to be here for the entirety, for the majority of this whole thing. So I'm going to give a great job. That's my whole expectation, is do an amazing job for you guys. At the very, very end, at the hour and a half mark, I'll throw out a quick special offer for you guys that do recognize that you need some help. But other than that, let's dive in. So who the heck are we? Well, we are Rectangle Health. We are the leaders when it comes to simplifying the business side of healthcare. We have, just on, say, the compliance side, almost 6,000 practices working with us nationwide and hundreds of thousands of more educated at the end of the day. Using our Bridge practice management platform itself, we have over 50,000 clients that work with Rectangle Health that trust us with all their payments, their compliance, their engagements, you name it, this is what we do. And just like our product, this education is built for you. We want to make sure that this is easy to digest, easy to use, easy to implement at your practice. So that's what you're going to get from us. Because at the end of the day, we know, hey, HIPAA is designed to protect the patients and their private information. OSHA, hey, it's designed to protect you, the staff. But at the end of the day, Rectangle Health here with this webinar, we are trying to protect your business and the business owners out there. This can be a costly thing, or it could be a very easy thing for you to manage at your practice. We're looking for the latter. We want to make it easy for you. That's the name of the game. So quick agenda of what we're going to cover here today. We're going to go over, of course, the basics. It is titled HIPAA 101. So we're going to go over the basics of HIPAA. I am going to go through the basic safeguards your practice needs to have in place, and it can't be HIPAA 101 without a risk assessment. We're going to dive into that. We're going to complete one here together. That way you have me here to hold your hands. We'll go over the number one threat to your data, which is ransomware and data security breaches. We'll talk about how do we respond? How does our emergency plan for these emergencies when they occur? And then I'll wrap us all up with simple 20 tips to be able to protect your practice, and a couple free offers, of course. So side note, hey, everyone always asks, hey, can we get a copy of this? Of course, we're going to give you a copy of the presentation. We're going to give you a recording. All of that will be sent to the email address that we have on file. So we're going to have that for you. Now, it does say no notes. We're letting you know you don't have to take notes, but if you take this job serious, if you are that compliance officer and HIPAA is your responsibility, do take notes. You're going to have an opportunity to work with a professional that'll be able to give you the answers to your specific practice. So do make sure you take notes. Make note of the things where you're falling short at your practice. Make note of the things you need to follow up on, and I'll make sure beyond this webinar, I give you the tools to be successful. We'll hold your hand, make sure you get it done. So without further ado, of course, we're going to be talking law. Yes, this is recorded, so there's that disclaimer, but we are talking law. So I need everyone to read this disclaimer for me real fast, and we can get started. Perfect. You guys got all that? Perfect, perfect. That's just a joke. I'm just messing with you. I didn't expect you to read that. There was no real information there. Look, the real disclaimer is there is no one-size-fits-all compliance solution. Yes, the HIPAA law is static. It's out there. Changes from time to time. We got to keep up with those changes, which can be a lot of work. But at the end of the day, how you and your practice execute HIPAA is very, very specific to you. Every single practice on this call, and we got over 500 of them now, you execute compliance differently. You have a different practice, you have different safeguards you need to have in place, different compliance officer, different training schedules. So we are going to make sure that you have what works for you, but I did need to plant the seed right now that there is no one-size-fits-all compliance solution. Remember that. And why is that difficult? Well, let me give you a quick example here. I'm going to pull up, or I should bring over, should I say, here is the actual HIPAA law. You guys can look this up at any time. Google HIPAA full PDF. This is the simplified version, my friends. And I notice at the top here, this is 115 pages, and this is a simplified version. Within this, you're going to get your favorite reading. If you have trouble going to sleep at night, I highly encourage you to pull out this PDF. It'll help you sleep like a champ. But of the 500 practices we have on this call, I want you to ask yourself, how many of you have read through this HIPAA law? Ask yourself, how many of you are delegating this to people at your staff to manage? And does your staff really have the tools to understand all 115 pages of this, 3 columns each of legalese? Do they have those tools? And that is why, just know you are not alone. Okay, at the end of the day, you are not alone. HIPAA is confusing. That is why I take it personal. It is my job to make it easy for all of you to understand. So let me tell you first, you got to take a look within. How are you currently handling HIPAA? Most of you out there, you're doing some work, no doubt. But I'd like to coin it as you're kind of casual and vulnerable, right? You have a loose training schedule, may or may not have a designated compliance officer, and if you do, have they been trained? How long have they been in that role? Who guided them? Do you have a physical HIPAA binder or a digital one? Is it customized? A lot of you are like, where is it? I was just thinking about that. I was going to dig it out. It's got cobwebs on it and dust. Where is it? Often those emergency plans, we work with practices every day. The number one thing they're missing is the emergency plan. And those practices are really defined by that term. We do our best and, we use common sense. But the reality is that's great for you, not good enough for the government. The Department of Health and Human Services, Office of Civil Rights, who enforce HIPAA, they expect you to run a formal practice that is secure. That means you have that training schedule. Everyone's trained on day one when they're in that office and exposed to PHI. There's someone trained that's designated running point on this for your practice. Everything's documented, the plans, the policies, the procedures. And often you probably need to bring in a little bit of help to make sure you manage all of this because it is a lot. So I am trying to make sure those of you who resonated with a little bit casual and vulnerable, my job is to make sure to help you move to the formal and secure. And that's what we're going to be able to cover today. So that big, huge HIPAA law, yeah, it's been around for a while. Since 1996, it really kind of came out. And it covers a lot of different things above protecting personal information, right? It covers people's rights to insurance, portability, things of that nature, things that aren't that exciting for the topics of this webinar. But at the end of the day, what's most important is it was modified, right? It was enhanced in 2013 with the omnibus rule, which added that little E in front of PHI that stands for electronic. That's right, y'all. You know it. We're in the digital age. Everything around HIPAA is pretty much revolving around electronic. About 95, 97% of it's all around electronic issues when it comes to HIPAA. So it's very important that we ourselves at our practice, some of you are probably very new practices out there, have been doing this for not that long. HIPAA's new. Maybe you're very, very aware of the cyber threats that exist. Many of you have been in business 10, 15, 20, 30 years or longer. And we have to continue to evolve to keep up with the threats that are out there. You guys can think about when HIPAA came out in 1996, many of you didn't even have an internet in the practice. Now we couldn't imagine living without it. So the world has changed. We have to make sure that we're changing with it in order to protect ourselves and our businesses. It's our job. So you gotta protect your data at the end of the day. That's what this is all about. Your data is under attack. One of the most common ways that your data gets attacked is ransomware, right? Ransomware, I'm going to define the term now. Ransomware is just like it sounds. You have some bad actors somewhere, let's just call them, maybe they're Chinese or they're Russian hackers. They have a whole crazy crime syndicate organized around getting on your computer, getting their software, however they need to, onto your computer, and then they freeze it up. It's frozen. You can't do anything with your computers. And they're saying, hey, you have a choice to make. You can pay us our ransom, typically in Bitcoin, so they can get away with it. You can pay us our ransom, but if you don't want to pay us, we're going to find somebody else that will. We're going to go sell this information we stole from you on the black market for people who want that data, people who want to have access to your files. And this happens every day. It really does. I like to point out real life examples in everything that I try to point out. Patient records sell for $1,000 on the dark web, and the price has only been going up. Why, I ask you, is it worth $1,000? Well, think about it. If I wanted to steal your identity, what better than your medical file? I got your name, your address, your phone number, your email addresses, your date of birth, your social security number. I know your next of kin because of your emergency records. Everything that they want is in that file. It's the most valuable file they can have. So they're going to go sell it out there, and now you're dealing with an even bigger issue at the end of the day. So we need to make sure, and we're going to dive more into ransomware and how we respond to these issues and how, of course, how we protect ourselves from them. But what do they want? Let's define it. That PHI, that protected health information. That's what they want. That name, that social security, your medical numbers, anything that's identifiable. This is what this webinar is about. How do we keep this information on your screen right now under lock and key and stop it from falling into anyone's hands who has no business dealing with it? That's our whole job. So people are out there buying these records every day. Actually, I had a website that I've been using for the longest called stash.to that I'd love to show, because it was literally a website that was selling credit card information, Venmo accounts, you name it, stolen credit card information. You could go online and purchase a batch of 100 debit cards that were stolen, which blows my mind, because people are literally on the internet putting in their information to buy. Like, don't you think they're going to steal from you? It really blows my mind, but it happens every single day. And I always feel it's very important to make sure I show everyone that this can happen to you as well. Let me give you an example. If you go Google breach portal, HHS, ideally, one of your top results should be the Department of Health and Human Services breach portal. Pulling that up here now. This is the website. Many of you have never seen this before. And just remember, these breaches are occurring every day, but it feels out of sight, out of mind to you. Trust me, there's not doctors in your neighborhood that are bragging to you that they got breached, or that they're going to get fined and audited by the HHS, the HIPAA police, as I like to call them. It's something that's actually occurring, though, even though it's out of sight, out of mind. This website lists all of the breaches that have been reported like they're supposed to. Let me scroll down to the bottom here real fast and point out something. There is 100 practices just on this first page alone, and it only goes back to December 26th. That is over 100 practices breached in the last 2 months around America. And take a look, in the reason: hacking, network server, hacking, EMR program, hacking. 90% of what you see on here, 95, 97%, will be a hacking digital related incident. And this is happening in every single state. It's happening in every single state. Out here where I'm at, St. Rose Hospital, right up the street from me, got breached this year, 2,600 records. Whereas out here in Texas, the Harris Center, 238,000 records compromised. Concentra out of Texas, almost 4 million records compromised. And this isn't just unique to you and your small practices, right? There's small practices on here. We got dentists, we got family practitioners. You can see healthcare provider, but it's also the people you're working with that HIPAA applies to. Business associates, them EMR programs that you're working with. We got their lawyers on here. This is happening every single day, my friends. And the pages go on and on and on, and they will keep going on and on. Every time I come on here, I can guarantee that I'm going to have 100 new records on this page over the last 2 months. I don't bring this up to scare you guys. I'm trying to make sure I bring this up early to let you know there's real value behind what we're teaching. There's a real reason we need to take it serious. It's our job, it's our responsibility, and we've all been on the other side of a data breach. You guys are getting letters from T-Mobile and all these other organizations, emails, letters in the mail, letting you know that your information has been compromised. I'm personally kind of tired of having to change my email, because every time I sign up with somewhere with it, within a year, I'm getting a breach notification. Oh, my password's been compromised. It's out there on the dark web. It's hard out there operating the way we are now. It's very, very hard. So it's very important to understand your data's under attack, and there's very specific vulnerabilities that all of you guys are dealing with. At the end of the day, there's some common ones. So if you have a breach, like I just showed you, if you were on that page, the government's going to come in there and do an audit and investigate it. And you can get fined nothing, or you can get fined a whole bunch. The question is really up to you. The key word here being, if you look at tier 3 and tier 4, the first words are willful neglect, meaning you knew you had to do this and you didn't do anything about it, right? Even if you find out today, if you get breached and you were trying to fix it within 30 days and you do, you're still getting fined $10,000 to $50,000 per violation. If you don't fix what happens within 30 days, you're already going to get the max of $50,000 per violation. I'm not doing this. I want to make sure you're aware. And that's up to $1.5 million per year. They don't care how big or how small you are. As I move through this presentation, I want you to maybe keep a mental note or on your notes how many gaps you have. Consider them a violation. Think about how much risk you actually have at your own practice that you weren't aware of before today. but it doesn't have to stay that way. It's our job to fix all this. I'm going to give everyone an off-ramp on how to fix their problems there at their practice with their HIPAA solution. The government wants to see, as indicated by their tiers, that you are actively working to do this. If the government comes in there and sees you've done everything you possibly could on your behalf to avoid this breach, you may not get fined at all. And that's the position you all need to be in. So let me tell you 4 of the most common misconceptions, 4 of the most common things I've heard in all my years working within HIPAA that gets practices in trouble. Here they are. First off, my IT firm handles my HIPAA compliance. Listen, your IT company, A, they probably have some stuff they need to do to adhere to HIPAA as well as a business associate. But B, there's not an IT firm in America that's going to pay your HIPAA fines for you. They are not responsible. An IT firm has some assistance. They have some roles in helping you respond to the breach. They have some roles before the breach in helping you stay protected. But no IT firm is going to pay $1.5 million fine for you. So it's very important to understand their role within your practice, where their liability begins and ends, and where your responsibility begins and ends. So if you think your IT firm's handling everything, you need to keep paying attention. Number 2, my practice management system, my EHR, is HIPAA compliant, so I feel like I'm safe. We're going to spend some time later in this hour and a half talking about what a business associate is, but that's what a practice management software is. It's their job. They're legally required to make sure that they are HIPAA compliant. So that's great. They need to be, but it has nothing to do with your practice's HIPAA compliancy. We're going to spend some time later talking about cyber insurance and the importance of it in this day and age. And I hear too many people say, oh, I think I'm covered, I have insurance. Well, listen, your general liability policy, your malpractice policy, none of that's going to protect you against the things that we're discussing today. And many of you who may have cyber insurance, maybe it's a rider. It isn't covering you as comprehensively as you may think. There's gaps. So I don't want anyone feeling false insecurity that they're covered. And the last one out there, this one is to my favorite people on earth, the office managers out there. The ones that are overworked, underappreciated, the ones that are in there first and out of the office last, the ones who wear 19 hats around that practice. I love you guys. Thank you first and foremost. But doctors out there that are thinking my office manager is on top of it for me, I guarantee these office managers are trying the best they can. But I promise you, many of them don't have all the tools to be able to get the job done. So it's important you're paying attention here, doctors, because if you do this job right, if you learn enough, you can give your office manager the tools to take care of it for you, where you can say, my office manager's on top of it for me, and you can feel really confident about that. I don't care what you're doing. See some patients, go to the golf course, whatever it is, have peace of mind doing it, because you can speak confidently that you've given them tools to be successful in managing this for you, not hoping they're on top of it. So we're going to make sure that I get you guys all safe, because we definitely have several risk areas we're going to be considering. We definitely want to make sure we're protecting you from the risk of non-compliance, the risk of data breach, and of course, all of those things that's going to do to you financially and reputationally that are going to really set you back. This is your business. You've worked your whole life to build it. A little bit of protection goes a long way. A little bit of attention to HIPAA can save your business and change the difference between retiring or not, or going out of business or staying in business. So with that being said, I want to take our very first step in helping you understand where you are. Let me talk to you about what a HIPAA risk analysis is, okay? If you're a doctor, no one ever walks in there and says, hey, doctor, I'm not feeling well. Unless you're probably a dermatologist, and the doctor looks right at you and says, I know exactly what's wrong. Do this, do this, do this, and take the medicine. That's not the way it really works. A doctor is probably going to say, yeah, I believe you that something's wrong. We probably need to run some scans, run some tests, maybe some x-rays. And from there, I'm going to have a better idea what's wrong with you, so I can prescribe a course of treatment. And from there, once you understand your condition and your treatment options, you now are educated and empowered to make the best decision for yourself on how to remedy your problem. That's what a HIPAA risk assessment actually is. The government makes you do this every year. The goal being that you do a risk analysis internally of your practice to be able to identify any potential weaknesses or threats or gaps in your HIPAA program. They want you to get ahead of it. They're requiring you to do this every year because HIPAA law changes all the time, risks change, staffs change. So it's an ongoing process as quoted here. So what we've done at Rectangle Health is part of our bridge compliance program. We offer everyone a HIPAA risk assessment. It's the first step in having a conversation about your compliance. For we believe in education. I'm not here, my team isn't here to sell you compliance, for example. We want to teach you what do you need, what are you missing, and then you can make an educated decision on how that works. But many of you have not done your HIPAA risk assessment for 2024. It's done. So I am going to walk you all through a HIPAA risk assessment. It's going to give you a score, and it's going to kick off a 27-page report that breaks down the gaps within your practice. So that way, post-webinar, we're very, very clear on what we need to do to right our ship. So all of you right now, I'd love for you to go to rectanglehealth.com/RA. rectanglehealth.com/RA. Here's what we're going to be able to do. So I truly only need one of these per practice. So the reason being is if you're the one in charge of compliance, if you're the doctor, you should take this. If you're the office manager in charge of compliance, you should take this. Both of you take it for sure. For everyone else, I encourage you to take it and not submit it. And the reason why I say it like that is I want you to have the experience of understanding what goes into a risk assessment. If you're just a staff member at that practice, it's important you know and understand what your office manager and your doctor is asking of you and to build your awareness of it. So everyone go to rectanglehealth.com/RA. It's going to take you to a sign up page that looks just like this. Go ahead and put your first name in there, your last name in there, put your doctor's name in there and your practice's name in there. Look, we've worked with nearly everyone in America, so we want to make sure we identify specifically it's you. Now, your phone number, put the best phone number for us to reach you in there, or the practice's main line. And the one trick I got for you here is under email. Because we've worked with most of America, you may type your email in here just like this, like I did, and you see it tells you in red the email address is already taken. That means you may have worked with us in some shape or form before. What I want you to do is I want you to go right before that @ symbol and add a 1, 2, 3, 4, 5. What that does, and I've done it before, so add a 1, 2, 3, 4, 5 before that @ symbol. What that does is it tells my team you're already in the system, because you can't proceed forward unless you change the email address here. But it allows us, when we get it on the back end, we'll delete the 1, 2, 3, 4, 5 and associate this with the correct record. Okay, code optional, type in webinar. So, all right. So go ahead and fill out that registration form and then click continue. Now, remember, I have 536 practices clicking continue right now, all at the same time. So give it a second for it to catch up. I've already clicked continue. Give it a second to get there. It's going to get there. For all the rest of you, again, if you're an office manager, fill this out. Do this risk assessment right now. It's only going to take us 10 minutes. This is vital. I need you to see early and often what you don't know and what the government expects. So go ahead and get that registered. Go ahead, click continue. It'll be there soon for me. It is definitely loading. I believe it's definitely loading. Let me triple check. There we go. All right, we are in there. If you're still signing up, go ahead, just catch up when you get a chance. For everyone who's in there, allow me to walk you through this, make this easy. I'm going to summarize these questions and make it easy to answer. So if you're following along with me, I'll make it real easy. Look, this isn't being reported to the government. This is for you. This is internal. So be as honest as you possibly can so you know where your gaps are, and my team can help you the absolute best. Number one, do you have a policy and procedures that covers how to protect PHI out there? Do you have policies and procedures? Yes or no? Or uncertain? Number two, when was the last time you updated those policies and procedures? in the last year, it's been over a year, or heck, Terry, we don't even have policies and procedures. Number 3, do you run a formal program to identify and address the gaps we're about to find during our risk assessment? And do you have all of that documented? Do you have a plan to get risk assessments done and fix the gaps every single year? Do you have that written down? Number 4, does your practice specifically have these policies? Workstation use, acceptable use, and sanction policies. Do you know if you have that in your HIPAA binder there and customized? Yes, no, or uncertain. Number 5, does your practice have policy procedures that keep track of people's computers and their activity? Does your practice monitor what websites your staff goes to? Yes, no, or ask IT. Number 6, every practice has to have a designated security officer that's making sure that HIPAA is being run efficiently and properly at your practice. Have you designated someone at your practice as that person, or do you know who they are? Yes, no, or uncertain. Number 7, does your practice maintain records to know when somebody enters the building or accesses certain information or accesses EPHI? Do you have ability to do that? I have, for example, my building, of course, we have key cards. I can't get in here. They know every time I step in here, and then they know when I get on my computer, they know what websites I'm going to. They know what I'm doing at all times. That's what it takes to protect all the sensitive information in our network. Are you guys doing something similar? Number 8 is about business associates, right? The people that you work with and you share PHI with. Has your practice taken the time to identify every single business you work with that's considered a business associate under HIPAA? Yes, no, ask IT. And if you have done that, do you have agreements with all of them? And do those agreements that say protect this information like it's your own, does it have an indemnification clause in that agreement that says if you get breached and you weren't protecting everything, you're the one that's going to hold the fines? So are they going to be held financially liable? Is that in your contract and your business associate agreement with them? Yes, no. Number 10 is pretty simple. Do you do screening of employees before you hire them, like background checks? Do you do any background checks? Yes, no, or uncertain. Number 11, when was the last time you actually conducted HIPAA training for your team? Within the last year, over the last 12 years, or heck, Terry, we may never have done HIPAA training, at least not since I've been here. It happens. And if you did do that training, number 12, how did you do that? Did you have an advisor come to your office? Did you listen to an over-energetic, coffee-filled, bald guy online? Did you purchase some content, or do you just do no training at all? Number 13, do you have a policy and procedure that specifically assigns roles and responsibilities in the event of a HIPAA emergency, right? In a HIPAA emergency, like a breach, people have to access information, people have roles that can then access that information. How do you define that? It's part of your emergency plan. Also part of that emergency plan, number 14, do you have a documented process of which systems to prioritize in the event of an emergency? Yes, no, or ask IT. Number 15 says those business associates that you have, do you have a formal policy in place and procedure of when you terminate your relationship with them? How do you cut ties and pull back all that PHI? Do you have that policy and procedure that defines how to do that? Yes, no, or uncertain. Number 16, you are required to keep everything in your HIPAA binder. Everything you've done for the last 6 years needs to be in that binder. Do you guys have 6 years of information in your HIPAA binder? Yes, no, or uncertain. Same thread of train of thought here, number 17. Do you have the documentation from your team saying, yes, I did my training and I read the HIPAA binder? Every year, everyone in your practice needs to go through training and sign off saying that they understand the policies and procedures. Do you have that for every employee for the last 6 years in your binder? It's a lot. It's a lot, right? Number 18. Does the person in charge of your practice's compliance program, or everyone in there, are they aware of what they need to do to adhere to the breach notification rule within the law? Meaning the law defines what you do in the event of a breach. Do you understand what that is? Don't worry, we're going to go over it today. Does your practice have policies and procedures that assign a unique employee ID number for each user, right? Can you tell which users or who as you're tracking information? Yes, no, or ask IT. Number 20 is about data backup. How are you backing up that PHI now? Do you do it in the cloud? Do you do it inside your practice management software? Do you have an on-site like physical hard drive? How are you doing that? Number 21, that data backup you are keeping. How many sets of it do you have? Do you keep just one version? Do you have multiple sets for multiple days in the week? Or you're not sure? Number 22, do you have a policy and procedure that breaks down how to restore that data backup that you have, right? That's why we keep a backup in case we ever need it. Do you have that process defined in your policies and procedures? And number 22 builds off that. Have you ever actually tested restoring that data? Do you know how long it would take to restore a full data reset within your system? Yes or no? Ask IT. 24 is very similar to a question we've already had, which is basically saying, do you have audit controls that monitor, record, and examine system activity? The difference is one, we're talking about actively looking and knowing where people are at and what they're accessing, but do you also have a process of going back and reviewing and auditing that? Yes, no, or ask IT. Number 25, do you have a policies and procedures in place that defines how to protect passwords and keeping them confidential? Yes, no, or ask IT. Number 26, do you encrypt information when you send it out, that ePHI? Basically, do you have email encryption in place? Are you using a third party for email encryption? Yes, no, or ask IT. Number 27, are you using some sort of email scanning software to check all the emails as they come in? Yes or no? Number 28, who's responsible for making sure all your firewalls and antivirus software and everything are all functioning and up to date? Is that your IT guy? Probably is. Is it the office manager wearing the hat of IT guy? I've seen it before. Or are you unsure? Number 29, here's what you do. If you use mobile devices, not laptops, use cell phones for emailing or texting of patient information, I want you to click false. If you don't use cell phones in your work, click true. Number 30, same thing. If you use a laptop that you walk around the office with or out of the office to use and send and receive PHI, click false. If you don't use a laptop at all to send information, click true. Number 31, do you have an inventory of all the actual physical devices in your office that contain PHI, right? My office, we got like 60 people in this Vegas office alone. Everybody's laptop has a number. We have a physical inventory of it. Do you have that at your practice? Yes or no, or ask IT. Number 32, have you developed a policy and procedure on how people gain access to your building in the event of an emergency? Yes or no? Number 33, do you have a specific policy and procedure on how you protect your computers, including remote access? This became real big back in COVID. People were always remote accessing their work computers. Do you have policy procedures around that? And even the ones that are physically in there, do we have policy procedures about how we protect it? I get up from my desk, I need to lock my computer, for example. Number 34, do you have a policy and procedure that defines how you dispose of an electronic device that may have ePHI? If I'm done with my laptop, do I have a process for how we get rid of it and make sure it's wiped clean, for example? Yes, no, or ask IT. Number 35 moves to credit cards, right? Because that's falling into PCI compliance. A lot of that very similar to HIPAA compliance because it's protecting sensitive information. If you take credit cards at your practice, how do you do that? Do you use physical credit card terminals? Do you do it directly into your practice management software? You have some sort of payment gateway you log into. And during PCI compliance, there's a thing called the self-assessment questionnaire. You have to do it every year. You would remember if you do it, it takes 2 to 4 hours to complete of how you take credit cards, how you protect that information. You do all that so you can attest that you are PCI compliant. You sign off saying, we are doing everything we're supposed to do to be PCI compliant. Have your practice done that in the last 12 months? Yes, no, or uncertain? Also part of PCI compliance is you have a scan of your IP address done every quarter. Think about it. It's like kind of like if you're in a ship and you check the outside of the ship for holes if it's leaking every quarter. Or is your practice doing that every quarter? Yes or no? Or ask IT. And if you are, do you have a copy of that PCI certificate on file? Yes or no? Number 39, if any of these questions around PCI compliance or payments or any of this is confusing, you need to understand, is it secure? Is it functioning right? Am I paying the right rates? Am I paying a lot of junk fees due to non-compliance? My team can help with that as well. Just click yes if you want a little bit of help of hand-holding to review your own statement and your system setup. Last 4 questions, guys. Number 40, do you currently have cyber insurance that's going to protect you against ransomware, HIPAA fines, loss of business profits, and other expenses related to a data breach? You either, yes, we have a comprehensive cybersecurity policy, or yes, we have one that's a rider to our general liability policy. And then some of you don't have one at all, you're just not 100% sure. Let us know, we'll help you figure it out. Ballpark, how many patient records do you have? Many of you are over 5,000. Number 42, how many locations do you see patients and or accept patients in? This helps us frame and helps you understand your responsibilities if you have more than one location. Number 43, how long have you been in business? Trust me, our newer practices have different problems than our very old practices. How many years have you been in business? Number 44, we turn our attention to OSHA. When's the last time how did you get your OSHA training done? Do you have an advisor come to your office? Do you do the training yourself? Do you do the training online? Or do you not do any OSHA training that you're aware of? Last 2 questions. Number 45 is, do you have COVID-19 employee training, and have you created a COVID-19 safety plan? Some of that's still out there. They've rolled back a lot of our freedoms, like they've given us the freedom to go back there and not have to stay home as much and things, but some of the stuff with OSHA is still in place. We got to make sure we're still on top of it. Last but not least, when was the last time you actually did an OSHA inspection of your practice? Was it you that did it? Did you have somebody come in and help you with it? Did you do that within the last 6 months? Within the last year? It's been over a year. After you get done, go ahead and click submit. All right, it's gonna start working for you. It's gonna start tabulating it up. Great job, all of you who maybe have done your first risk assessment ever. Great job. That is literally HIPAA 101 to be able to take an inward look at where you're at with your practice's compliance. And what it's going to do is going to tabulate a score. And at that point, it'll tell you to get something booked. Okay. Now, your score, chances are, is not going to be 100. You could be at a 99. There's something in there that you're missing that could come back to bite you. We want to help you with that. So just be aware, after this, all of you are going to have an opportunity to sit down with the compliance officer at our organization who's going to give you education around what happened around your risk assessment. We're not here to sell you. You don't even know if you need the help. Let's just focus on the education. We can take it from there. So let that thing tabulate. My team's going to get all those on the back end. We'll call you and get you a copy of that 27-page report. So great job. Keep an eye out for your score. Other than that, let's keep moving in this webinar. I told you it was going to go fast. We're already halfway there. All right, let's jump in to the work. And I know it's taken a while to tabulate those scores because, again, there is 525 of you clicking submit at the same time. Give it a second. Let's dive into a little bit of education here real fast. So the law has several different sections in it as far as HIPAA is concerned. One of those is the HIPAA privacy rule. And this is just the basics of everything that goes around. How do we keep information private? I love this cartoon. I used to love these cartoons. I don't know if you guys are as old as me. You used to have the ones on the desk, and every day you can kind of flip back and get another one. According to your HIPAA release form, I can't share anything with you. And the patient's looking at them like, are you serious? that's what it kind of feels like when it comes to HIPAA sometimes is, man, what can we share with people? I feel like I can't tell them anything. Well, there's a very specific rule on what that looks like and how that works. Okay. Obviously, it needs to be in writing. Okay. So you have to get an individual's written authorization in order for you to disclose this PHI to anyone else. You have to be able to, they have to give you permission in writing, and it needs to be very, very specific. Okay. A great example of this is your employer sometimes wants your medical history. Your life insurance typically wants some medical history, right? You have, many of you who sent your kids to college know that they need a lot of medical history when you start a school sometimes. Your doctor can't just blindly give that to them. You have to get permission from you in writing. It has to be very, very specific. So let's talk about what are we permitted to disclose and when are we permitted to do it. So a couple examples here. So obviously when it comes to the individual, when it's their own information, it's mandatory. No matter when they ask for it, you have to give them access to all their PHI information that you have. And you also need to have all their disclosures that they signed, right? When they walk in and they sign a notice of privacy practices at your practice, you have to have records of all those as well to keep those on file. So obviously to the individual, you have to give it to. Now, you also are allowed to give, these are all things you're permitted to do as a practice. Treatment, payment, healthcare operations, right? Doctor to doctor, your dentist throwing a referral to an ortho, your primary care, and you're giving a referral over to a derm, whatever that is, they're allowed to share your PHI. They're all covered under HIPAA, so they're all keeping an eye on all that. So obviously, a patient can also decide they don't want you to give out information. A great example of this is people's family, right? It could be my wife, but if I tell you I don't want you to share my information with her, I don't even have to put that in writing. I could just informally tell you that. I could tell you verbally, make sure you don't give my wife any information about my personal medical history. And the practice has to adhere to that. So what about, I think there's always that great example. We've all unfortunately been to a hospital before, and we're walking and visiting a friend or a loved one, and there's all types of charts and medical information on all the walls that we're walking by, and we're thinking, isn't that PHI? Isn't that pretty private information? That is very true, but that falls under the minimum necessary rule, right? If you have to have PHI out, it should be as minimal as necessary, right? And it can be reasonably, for example, sign-in sheets at the front of the practice. You're allowed to say your name, what doctor are you here to see, what time is your appointment. You're not allowed to write on there and have them fill in, what's your phone number? What procedure are you here for? These are things that shouldn't be on a sign-in sheet at a practice, because that's somebody's personal information. What I'm here for is nobody else in the waiting room business at the end of the day. Those are just a few of things that are actually, permitted and you're allowed to do. So what else is required when it comes to HIPAA? Well, there's 3 basic categories you can break down HIPAA into, okay? And those 3 categories, pay attention to this. There might be a quiz question, a polling question around this here soon. Jacob's slick like that. He likes to slide in questions when you least expect it. 3 areas. One is administrative safeguards. That's all the policies and procedures. Think of that as all the paperwork, all the things that are written either on what we will do or what we have done. That's your administrative safeguards. Technical safeguards are all that IT stuff. How's IT helping keep our stuff safe? And then there's physical safeguards, right? Locks on a door. That's a great example of a physical safeguard that you want to keep an eye on. So let's move into the specifics of HIPAA and let's walk through some of these very directly. Let me pull up here. So let's start with the binder. Oh, the binder, the HIPAA binder. Let's talk about that. So the HIPAA binder is the key part of any practice. Let me give you an example. So your practice probably has a physical binder around there. Hopefully it doesn't have dust on it. That binder, within it, a couple things you need to know. It needs to be customized to your practice. So you can't go buy a templated binder online and just say, we have one. That's not good enough. You got to customize every single one of these policies and procedures. And you have to keep them updated, right? Rules change all the time. It's important that you stay up to date on those. Let me give you an actual example of some of these policies and procedures you need to have in place. So I'm going to go log in to our bridge compliance solution here real fast. So just know everyone at your practice would have a login to the solution because everyone has to have access to your binder, for example. Okay, and obviously these views are a little bit different because if you're, if you're the office manager or the doctor, you're going to have full access to this digital platform, whereas staff only have access to things like training and policies and procedures, of course. So I'm going to shrink down these things we don't need right now. We're focusing on HIPAA only right now. So for all of my clients on here, so I have to address this. I have at least 100 clients on here. Remember, we've merged everything all into one. So whether you have our payment solution or you have our engagement solution, this would be under the compliance tab. So bridge compliance. So flip over to that. You can access it there. Then under the HIPAA tab, I want you to click on documents and policies. This documents and policies is a great example. This is your digital binder. So all of our clients, we give them a digital binder because that's going to be the most accessible and the easiest for us to update on their behalf. Many of you also still request a physical binder from us, and we give that to you as well. But in the event of an emergency or an audit, you're going to lean on the digital binder because it's the most up to date. The topic here is policies and procedures right now. So I'm opening up our policies and procedures. I'm going to go real slow here because I know how GoToWebinar can be. But you as a practice are supposed to have every single one of these one of these policies and procedures, okay? I'll start with example, password security policy. When I say customized, you need to go in there and define this password policy. How difficult do these passwords need to be? How often do we need to change them? How many capital letters need to be in it, right? Things like that are how you go in and customize these policies. And when I say keep them updated, this is also a great example because pre-COVID, there was no password security policy. You would think it's common sense to have rules on your team on how difficult your passwords need to be. No more home row passwords, right? The ASDF, JKL, semicolon, those are not acceptable. But unfortunately, due to COVID, it exposed so many practices, and the government says, hey, all of you are having trouble with this. We're going to create a law or a rule that makes you follow this. So now they're making you document how difficult your password needs to be in your binder. But this is just a great example, but there's all of these different policies. Even if they don't apply to you, you got to go in there and say, this does not apply to my practice. So I'll stop here because I don't want to overwhelm you with all these policies and procedures, but they can get hefty, right? I can open up one here, take a look at it. They can get real hefty, right? This needs to be customized to your practice. So the bottom line is your policies and procedures customized? Do you have them all, and are they updated? And does every single person on your staff have access to that binder? They have to have access to it. So think about it. All right. I told you all there's going to be a polling question, and I kind of am going back to a couple slides ago. I didn't want to make it too easy. So we're going to do this polling question. Jacob, you ready to go with this poll?
I am ready. All right. Which of these are not one of the 3 key HIPAA safeguards? Is it physical safeguards, office safeguards, technical safeguards, or administrative safeguards? We'll give everyone about 10 seconds here to get in those answers. What do you think, Terry? Have they been paying attention?
I sure hope so. I sure hope they have. I know they typically get stronger, but this group, I see they're super active. I'm going to say we got a good 85% correct on this one.
All right. So it looks like we had 14% say physical safeguards, 73% say office safeguards, 5% technical, and 8% administrative safeguards.
All right, we were close. 73% of you were 100% correct. That is B. office safeguards. It's administrative, technical, and physical. They're kind of all within the office, right? So 73% of you, I shot for 85. I promise you, Jacob, this group will do better the next 2 polling questions. I know this group. I have faith. I'll do better. I'll do better teaching them. All right, well, great job, you guys. We'll have a couple more polling questions, so let's dive back in. Next thing I want to talk about is business associate agreements. So this is also something that you're going to find within your binder. There should be a tab that's tabbed business associates agreement, okay? Now, there's a couple different people in here. HIPAA applies to covered entities, which are you, right? You're the one that received the PHI. But you immediately kind of share that with other business associates, right? Take the one all of you have, your practice management system. Let's say you use EagleSoft. Well, the minute I give you my name and personal information, you typed it in there, they have it. Also, you might be backing up your data. Your IT guy is helping you with that. So your IT guy has your data, right? Already, that's 2 business associates. And a business associate has to sign an agreement. That agreement is saying, hey, you are giving us access to your practice's PHI, and we're going to do everything we can to protect it the right way. HIPAA applies to them as well. So you have to make sure they do that. So we're defining a business associate as a person or entity that performs certain functions or activities that involve the use or disclosure of protected PHI on behalf of a covered entity, which is you. This is absolutely important. I love real life examples. Let me give you a real life example here real fast. This article, so the Department of Health and Human Services doesn't have a big staff. They're not going to come in there and audit you. You're going to actually have to do something wrong, and then they're going to come in there and audit you. So the old term is, when it rains, it pours. You are unfortunate enough to have a data breach. Next thing you know, you have HIPAA police knocking at your door saying, hand me your HIPAA binder. I need to look for every single thing you're missing because I'm going to find you. So HIPAA, then they try to make examples of people. That's the best way I can describe it. So they can create headlines like this that scare you into adherence. This is the story of North Memorial. It's a tragic one. They're not even for profit. They're a not-for-profit healthcare system, not even trying to make a buck. But they did 2 things wrong that cost them $1.5 million. First thing they did wrong, they failed to implement a business associate agreement with a major contractor. That major contractor, the business associate, is the one who got breached. It wouldn't have been a problem. Had they had the agreement in place, they would have been safe. It wouldn't have been their fault that that practice got breached. But since they did, HIPAA came knocking at their door. And HIPAA said, well, how come you didn't know you didn't have a business associate agreement? Brings up the second reason they got fined. Failing to institute an organization-wide risk analysis to address the risks and vulnerabilities that they have. This is exactly what I helped you all with earlier, was a risk assessment. If they would have took that 10, 15 minutes to do that risk assessment with us, they would have realized they're missing business associates agreements with their major contractor. And they could have went in there and gotten that fixed. They could have done the risk assessment for 10 minutes, and then they would have got that agreement signed, and they could have saved themselves $1.5 million. Now they're on that website. Now they're over here on the breach portal. Let me show you all here real fast how easy I could have saved them $1.5 million had they just did what's so easy to do. I'm back in our portal here. I'm going to the Business Associates tab. Manage your business associates. Here's how you save $1.5 million in 30 seconds, team. Create business associate here at the bottom. Boom, boom, boom. We type in all their information. Fill it in. Now we see them listed here on our list of business associates. I got my practice management system here. I have the date I created this agreement. I have the date I sent it out directly in this portal. I can send it out directly to that associate here. And I am notified and alerted that they signed it and executed it. And of course, I have to have this on file. It's forever now on file. I click view PDF. It's on file in my digital binder for me. And I brought up several times the key part of the risk assessment, of the business associate agreement, is the business associate agreement is the indemnification clause. So this is the part that's going to financially protect you. So on page 5 here, we'll have the indemnification clause that protects your practice from financial risk if that business associate doesn't do his job. You see how easy this could have been for this practice to save $1.5 million? This, you all, many of you are small businesses out there. You can't afford these HIPAA funds. So I always kind of look at it as you can't afford to not run a formal HIPAA program because the alternative will put you out of business. So here's a short list. All these people, a quick cheat sheet of what people you work with need a HIPAA risk assessment, a business associate agreement, and which ones don't. Okay, your CPA firm, legal services, consultants. If you're hiring someone to do email marketing for your practice, you're giving them email names, right? Names and email addresses, they're one. But there are people who don't need it, right? You don't need your janitor to do it. Your employees don't need one because they are covered under the entity itself, so they're not a business associate, right? We already talked about how other physicians and healthcare providers that you do business with, they don't need to sign a business associate agreement. It's everyone else at the end of the day. So there are always going to be exceptions to the rule, but just make sure that your agreements have a business associate agreement, has an indemnification clause in it. Can't drive that home enough. So to all of you out there who had faith in, now's your time to prove me right. Polling question number 2. Jacob, you ready for us? I told you they're ready. I'm going to get them ready for you.
I'm ready. I'm ready. All right. Which of the following is not considered a business associate? Your landlord, your IT provider, your software provider, or all of the above? All right, votes are coming in. We'll give everyone about 10 more seconds here. I see we've got about 55% of you have voted. All right. Looks like we had 80% say your landlord, 1% your IT provider, 3% your software provider, and 16% went with the common all the above answer.
That tricky all of the above, right? It got us through so many tests in school, but unfortunately that is not the right answer today. The answer was A, it's your landlord, right? They don't necessarily have access to your PHI, so they are not one. Your IT provider, absolutely, they have access to everything. Software provider, we talked about practice management systems. So the answer would be A, your landlord. I got one more shot at this, Jacob. I'm gonna get them to 85 by our next polling question. All right, y'all, let's keep it moving. Let's talk about training. Everyone knows about training. It's one of the most, it's like the one thing everyone does know about HIPAA, right? Hey, a couple things that matter about our HIPAA training. One is modern and relevant information. You can't use the CD or DVD that you had from 10, 15 years ago. It needs to be modern and relevant. Secondly, it needs to be conducted every year. That's just the best way to do it. Just set the schedule on your calendar to make sure you get it done. Third thing, your employees need to sign off saying that they acknowledged the training, they got it done. You need to have that I completed my training signed off document for every employee in that binder. Do you have that? Okay, there's a lot of ways to get training done at the end of the day. I encourage you to make sure you have a plan in place. One of the most important things I need you to do is make sure that those new hires get trained on day 1. On day 1, they need to be trained at the end of the day, right? They get access to things right away. So let me give you an example. If you're with our platform, for example, you go into your HIPAA, we have a whole section here, not under HIPAA because we have all our training in one place. Office Safe University, you have HIPAA training. I want you to notice these little red exclamation points that are on here. This portal will alert you when somebody's overdue getting their training on your staff, right? This saves you the work. It's important there's something looking out for you on how to get it done. We have training specifically for those HIPAA officers in that practice. 2-hour CE course, trains the HIPAA officer on what they need to do. But we also have HIPAA quizzes. And this is important. So they watch these 6 videos, they take these 3 quizzes. I bring this up to show you how easy and on demand this training needs to be for your staff. You can go inside, I'm going back to the binder, okay, to the documents and policies, and under employee acknowledgements is where I know I have all the records where I say my staff have to sign off and say they did it. I have it all here, right? I have the dates they completed it and who in the practice says did it. and remember, they not only need to do their training and sign off on it, they have to review the policies and procedures and sign off on those as well. So you'll be able to find those under your employee acknowledgements log. I show you this because this is what you need to have in your binder. Does your binder have all of this as far as training in there? If not, you got some work to do. This is 101. Most of the breaches I showed you on this website are caused by employee error. Somebody opening an email, somebody doing something, they accidentally sent the email to the wrong person. Very simple things can open up a can of worms that you do not want to pay for. I promise you that much. And while we're on training, I do want to mention, hey, I'm not doing an OSHA webinar right now. Tune in next month for that. But at the end of the day, you have OSHA training that's required as well. Does your team have access to all that? That needs to be done every year as well. They need to do the COVID-19 training. They have to do the bloodborne pathogens training, the HAZCOM, the infection control. Everyone in your staff needs to get this done too. I bring up this OSHA training in this HIPAA webinar because there's a term I like to instill in all of you that I want you to have at your practice. And that's a culture of compliance. Culture of compliance. The way we operate always keeps being compliant in mind. So I don't want you to think of OSHA training without thinking of HIPAA training, without anything else. So it's all part of creating that culture of compliance. So I'm not going to go into it today, but I do have a lot of resources to help you as well, right? You need to have a very specific plan. California people have more OSHA stuff than anybody. So at the end of this webinar, we will email you out an OSHA readiness checklist. So that way you can give yourself, in your spare time, do a self audit of your OSHA program. I care about more than HIPAA. I want you guys to be open and practicing and thriving for years to come. HIPAA and OSHA can come back and mess all that up. So stay on top of it, okay? So I'll get you some additional resources post webinar. So let's move to the last major topic I want to touch on, which is the most major thing that's a threat to everything that we talked about, and that's cyber breaches, okay? 95% of breaches are caused by the humans. I told you that. And the reality is, we know, because we've worked with almost everyone one way or another, that 77% of organizations don't even have an incident response plan in place. And most companies, it takes nearly 6 months to detect a data breach. And we're going to go over what that means. What do you do in the event of a breach? But it's important that you understand this is happening all the time. So we need to take the steps on how we're going to get that done. So step one, make sure you have email encryption in place. Do you have email encryption in place? Simple, yes or no, right? And do your employees, are they trained on understanding what types of emails to open, what not, right? And please, you need to use a encrypted, secure type of network, okay? Those of you out there, I love you. If you have a Gmail and Yahoo, I like you. I don't want it in my doctor. I don't want my doctor emailing me from gmail.com. Now, if you have an AOL.com email address, I respect that. That's pretty cool. You're holding on, but it doesn't meet the safety standards that we need for business services. So make sure you're upgrading yourself and stay professional at the same time. And of course, get that email encryption in place. So the question is, what do we do, Terry, if we have a breach, right? This cartoon is a great example of that. We have a plan, and that's to run around saying, what do we do? What do we do? What do we do? That's many of you out there. I can relate. I've been in these situations, not when it comes to HIPAA though. So thank goodness, not when it comes to HIPAA. So you need to make sure you have a plan first and foremost. I just said 70% of you don't have a plan for how you handle HIPAA. So let me just give you a quick glimpse of what that looks like. You need to have a plan. So I'm going to go to the portal so I can show you an example of what a proper plan looks like. I'm going to go to HIPAA, and I'm going to go to the emergency planning tab. Okay. Here is a short summary. They all drop down, but summarized view of in your emergency plan that you may or may not have at your practice. And inside of that binder, have you defined who is on that emergency and incident response team? You have to define that. Is it your office manager? Is it your compliance officer? Who are these people in charge? You have to break down how you're backing up your data, because it's not about how you back up your data, or do you back up your data? It's about do How often is that email backed up? Excuse me, that data backed up? You have to define all of that in here. Thirdly, we have to go over the emergency mode of operations. What happens in the event of an emergency? That's the question. How are you protecting yourself? What needs to happen? We kind of went over that loosely in the risk assessment. So I'm not going to get all detailed into it. But at the end of the day, once you fill out and customize all of this stuff, you're able to print out the download the plan and add it to your binder. And of course, it's in here digitally. You need to have a plan for how you're going to address and protect yourself. It needs to be defined. Most of you are missing this on there, and it usually need a little bit of help to help you get it in place and built the right way. That's why a lot of people turn to third parties. So make sure you're doing that. And this stuff, again, is happening all the time. It can happen to you. This one was always crazy when I talk about data backup. Here we go. Hundreds of dental offices crippled by a ransomware attack. We have no access to patient charts, schedules, x-rays, or payment ledgers. The doctor cannot do proper treatment without a chart history and x-rays. What does that mean? It means they stopped making money. That's the beginning of them not making any money, right? So it may not be you. You're in this particular situation, and a major IT company, two major IT companies who were handling data backup and things like that for these organizations, they were breached. They had a ransomware attack. So they went down. It had nothing to do with the individual practice. That's why it's important individual practices have data backup. Are they making sure they're backing up their data, and do they know how to restore it? Because it may not be your fault, but you can't sit around not operating and not making any money because your IT company went down, right? So ask yourself these questions and make note if there's something you need to revisit post this webinar. Are you backing up your data? Have you ever tried restoring it? How many data sets do you contain? And the hard question for my doctors out there who are in business, how long are you willing to be inoperable and not make any money in the event of a data breach? That's the question. And do get 256-bit encryption on that, at least that. So data backup, super, super important. So I think I've made my point, right? This stuff is happening every day, whether you see it or not. Ransomware is a real thing. I'm in Las Vegas. Our whole school district got hit by a ransomware attack. It shut the whole, every teacher and student had their social security numbers released out there on the internet. And we have the second largest school district in America. So it's not just a medical thing. Ransomware, these cyber attacks, you guys all probably heard about MGM casinos out here getting hacked last year. The casinos were down for 3 days. So it's not just healthcare. Healthcare is just easy pickings because you guys have the data that's so valuable that you're willing to pay to get it restored. So we talked about ransomware. We talked about how it gets on your computer. If you walk into your office one day and you see the screen look like this, I promise you, go ahead and take a shot, say a few curse words, because it is about to be the beginning of a long day. I'm not going to lie to you. If you see your screen locked up, now I want you to ask yourself, if you walked in that office and saw this, and you realized you're having a data breach, a cyber breach, what do? Well, you don't have to wonder, thank goodness, because the law tells you exactly what you need to do at the end of the day. Here's the steps. A, you need to have a complete forensic analysis done of your computer system. We need to figure out how deep was the breach and how much data was actually compromised. Did they get access to all your information or just some of it? So we got to do that data segmentation. Of the people that did get breached, we need to alert them via first class mail. We have to put together an FAQ for them. We have to post it on our website. You have to alert the local media. That's why there's so much news out there. That's why there's so much news out there around this stuff, is because people are required to post it. If I type in ransomware news, right, you're going to get pages and pages of ransomware news, right? FBI warns U.S. healthcare sector of targeted black cat ransomware attacks. This was 6 hours ago. I can't make this up. I didn't even know this was going to be here. It's the first headline. At the end of the day, is FBI warned healthcare about this today. I can't make this up. U.S. pharmacy outage started yesterday. United Healthcare unit down yesterday, right? So there's I could just keep going on and on and on, right? This is yesterday. Henson Consumer Center goes down. Fulton County, Georgia, they had till 8:39 a.m. to pay the ransomware. Like, this was 17 hours ago, you guys. This is happening every day. This is crazy. You can pull up the news like this, and it's every day. So if you don't believe me to be protected, you need to make sure you're being protected. So you got to alert the local media. You got to set up a call center for 90 days minimum. You do all of that right and notify the Department of Health and Human Services like you're supposed to. And how are they going to reward you? They're going to walk into your office and say, shh, don't say a word. All we need is your HIPAA binder. And they are going to judge you based on the HIPAA binder. Because remember, this binder has policies and procedures. Policies and procedures define, if something were to happen, here's how every single situation that could happen, here's how we handle it. And then everything you're actively doing when you do training, when you log in a building, whatever it is, every one of those things are recorded in here as well. This is how you'll handle the future and how you have handled the past. And they're going to issue out fines based on how well you're doing that. It can happen to you, so we got to make sure we're prepared. So if a lot of this happens from opening the wrong emails and stuff, let me see if some of you guys can identify that. Here's a great example. Okay, here let's play this little game here. Here's an old email from Costco. What are some of the things that you see here that make this look a little fishy? Well, I'll point out after the first word, unfortunately for me, grammar was the worst thing I was at school, but I know there's a comma that goes after that. So that's a little weird. There's some bad grammar here. You are recommended to complete this form and send back with your reply to us. They give you a timeline. Hey, you better do this within 1 week or we're going to give you 21% less of your money back since you booked it for Christmas. Like, now they're like threatening you, like, hey, your Christmas is going to be messed up, right? So these are all signs saying, this email at an initial glance, it looks good on the outside, not so good on the inside once you take a look at it. Let me give you another example. Here's PayPal. What looks fishy to you about this email? Right? It's from PayPal, but yet when you look at where it comes from, it's like up.com, right? You got some weird formatting things in here, the space between the semicolon. Your account has been suspended as an error was detected in your informations. That's not how we talk around here too much, right? So there's crumbs and clues to bad emails. Are you training your staff on how to identify this? Are they trained to say, I'm not just going to blindly click on links and open attachments because it may look good on the outside, bad for you the inside. Last one, I guarantee you looks good on the outside, bad for you on the inside. This Kentucky Fried Donut sandwich. Okay, it's 11:30 here. I'm hungry, but no, bad for you on the outside. Oh, actually, it looks really good on the outside. Bad for you on the inside. Little corny joke. Jacob hates it. I love it. I don't care. Time for our final polling question. Jacob, they're ready for you. We're getting 85% or above on this one.
I believe. All right, which is true about ransomware? The payment of ransom is typically through Bitcoin. The email phishing is a common gateway to network access. Ransomware can encrypt or lock your data, or all the above. Let's see. Give everyone a few more seconds here. All right, Terry, we did pretty good here. 2% said the payment of ransom is typically through Bitcoin. 4% said email phishing as a common gateway to network access. 1% said ransomware can encrypt or lock your data. And 93% said all the above.
Let's go. 93%. I knew we're getting smarter by the minute. So unfortunately, we have 11 minutes left, but we're getting smarter by the minute. Great job, you guys. That's right. All of this can lead to ransomware. So let's talk about that. We have a ransomware attack. It could happen to you. What does that look like? Right, here's a real life example. Dr. Sharma had a ransomware attack. $90,000 in legal fees. Over $37,000 in just the cost of decrypting and restoring the data. Of course, by law, you have to have a forensic investigation. Those guys aren't cheap. $54,000. And we still had to pay 2 rounds of ransom to this group to get them to give us the key. And that was over $16,000. So nearly $200,000 worth of costs. And mind you, if you do everything right when it comes to HIPAA, right? If you're doing, let's say, for example, you're working with us, you're doing everything right. We've eliminated this risk for you. You're not gonna have to worry about HIPAA coming in here and fining you and saying you didn't do something right. So you've eliminated from the audit risk, but you're still on the hook for the cost associated with a ransomware attack. And that is why, my friends, why I said in this day and age, you have to have cybersecurity insurance, okay? Malpractice insurance, required. General liability insurance, required. The one you're gonna use the most, cyber breach insurance, not required. It's just a good idea. A lot of you have worked hard. You have life insurance, you have car insurance, you do things, not just the car insurance you have to have. Some of you had gap insurance and other things to protect yourself because you realize it's likely. All of you, you need to have a comprehensive cybersecurity insurance plan. You really do, to protect yourself and be safe. Ours, that comes with our program, for example, covers everything you could imagine you really need it to cover at the end of the day. First of all, you have that new employee that opens the wrong email. Now you're dealing with a breach and you're gonna have to pay some cyber costs. You're dealing with a cyber attack. Companies come in there, we gotta do that $54,000 forensic investigation. You're probably down for a day, you're losing business and profits, right? You gotta restore your data, that's gonna cost 5 figures. HIPAA police try to come in there and they find something stupid to fine you on. Whatever it is, this is gonna protect you, right? We've done all the research. For the general practice, a $250,000 protection, you're good. If you follow our program and do what we tell you to do, we alert you when things are wrong. We tell you when somebody's overdue on training. We make sure everything's customized. Do what we tell you and we guarantee we'll protect you in the event that something still goes wrong. That's peace of mind for my business owners out there. Is your investment into your business protected? So you gotta have cybersecurity insurance. All right, hopefully there's no questions there because we are moving on and we're gonna begin the wrap up process. So I'm gonna close this out with my 20 tips to protect your practice. Number 1, please, friends, update your HIPAA binder, your policies and your procedures. This is 101. There's a hard way and there's an easy way, right? If you want to go get a law degree and try to figure out how to do it all on your own, feel free, okay? You can buy a templated binder and then you got to still go through, fill in all the blanks and hope you did it right. And then the third option is obviously you work with a company that makes sure you don't miss a beat. And they instill that confidence in you that they're taking care of it and your policy procedures are tight, airtight, okay? So get those binders up to date. Number 2, make sure everything you do is documented, and obviously it's also secure during an emergency. Remember, I told you that binder is everything you've already done in the past should be documented. Make sure that this is your receipts, right? This is how you show your boss and you show the HIPAA police, I'm doing everything I'm supposed to do. To document everything, because during that emergency, that's when it's going to come in handy. Is do I have a plan I'm executing, and do I have, if somebody comes in here and snoops around, are they going to see I'm on top of it? Number 3, make sure you get those business associate agreements executed and make for every single one of them. If you're in doubt, ask us, is so-and-so a business associate agreement? I'm confused. A business associate, I'm confused. A common mistake I see all the time is people have business associate agreements signed that were given to them. Let's take your practice management software. They give you one, you sign it, you don't give them one to sign. So they're protected, you're not. So they're always an exchange of 2, and make sure that indemnification clause is in there, of course. Number 4, make sure you're documenting all of your progress. I kind of talked about that in number 2, just every time you make progress. Look, HIPAA is going to say, oh, you guys attended Terry's webinar. Great. What have you done since? He had you do a risk assessment. You identified gaps. He gave you all this education. Make sure you're documenting your progress. If you have a breach tomorrow or in a week from now, you may not have fixed everything in your program, but it's super important you're showing HIPAA that you're taking active steps. That minute you found out that you're righting the ship, they will fine you less and take that into consideration. Number 5, never share patient information without authorization. If in doubt, double check. There's nothing wrong with that. No one can be mad at you that you're verifying who you're speaking with or you're verifying where you're sending an email before you do it, because you don't want the alternative. I've explained that a lot. Number 6, Do your employees really know the dangers of downloads and how easy it is to click a link and how quickly it downloads? You know, there's pop-ups that say, would you like to open or close this? And you click close, but that's all programming. Close actually means open, like they set you up. So the key is to never click on the link in the first place, because we're scanning the email. We're trained on the dangers of downloads and emails. Number 7, never wire money from an email request. Make it a verbal confirmation. I wouldn't put this in here if it wasn't happening all the time. A lot of you are like, who would do that? Oh my God, it happens all the time. I swear on everything I love. 2 years ago, I had an employee bust into my office. Literally, he's my frontline type of employee. He's like, hey, I need to run to Walmart. The CEO needs me to send him a wire. I'm like, you work for me. How is this happening? I've trained you guys all in so much. But look, it happens all the time. That's why a culture of compliance, keep bringing it up to your staff. You could think you do a great job of training. All knives need sharpening from time to time. Number 8, be careful and be aware with new employees and their access to PHI. My simple rule is train them in day 1. So ask yourself right now, do you have the tools to train a new hire today if he started today? If not, we need to fix that. Number 9, don't share photos or information on your website or social media without patient consent. True story, University of Texas in Austin had a famous Hall of Fame running back in there for cancer treatment. One of the nurses sent out a photo. Get well, mister. I'll leave it alone. That was a breach. He didn't want the world to know he's in the hospital. That is a breach of PHI. Make sure your staff knows that. This also applies to responding to Google reviews and such. Be very careful. Number 10, no more home rule passwords, okay? No Terry loves pizza 123, whatever it is, make those passwords a big deal, make them difficult, change them often. Number 11, if you walk away from your computer, your laptop, your cell phone, make sure it locks, okay? And if somebody doesn't know the passcode, make sure it erases that data if they don't get it right. Number 13, always keep all your systems up to date. Windows and all that, they automatically find out about some of the new stuff and they send out updates to you all the time. And it's usually just to protect you against cybercrime. 14 is data backup, at least 256-bit encrypted solution. I prefer cloud backup, and there's multiple days backed up, multiple sets, multiple weeks backed up. You never know when you discover a breach, so you need to make sure you're doing it right away. Number 15, plan for an emergency, expect an emergency. Is your binder ready for an audit? Number 16, stay off of public Wi-Fi. It's no place for business, okay? I'm not even gonna warn you the Googles of it. Google the word crack with a K, and you could see some horror stories of what happens when you use public Wi-Fi. Number 17, try not to keep PHI on your laptops, okay? North Memorial, that's what happened to them. That $1.5 million fine, they hired an outside billing company to collect for them. Guy had all their patient information on a laptop, went to Starbucks, laptop was stolen, cost North Memorial $1.5 million. Don't do it. Number 18, please, y'all, get rid of Gmail, AOL, and Yahoo. Not professional, get a professional exchange server with professional security. Number 19, go get that cyber insurance or whatever you currently have. You should be clear on what it does and what it doesn't cover. You should be clear on what the fine print is. And with most writers out there, if you have a writer of your cyber insurance, there's a fine print there that says, if you aren't adhering to HIPAA, we're not going to cover you in a HIPAA breach. So think out how hard that is to do. And number 20, make sure you have your PCI certificate when it comes to taking payments. Look, y'all, it's been an hour and a half. Breaches are going to happen. Avoid the worst of it with willful neglect, right? Rectangle Health, it covers everything. Your policy procedures, your payments, your OSHA compliance, your cybersecurity, your licensing, your CE. Does the current compliance company you have do all of this for you? Are you confident you're safe? If not, there is greener grass out there, and I'll stand behind it. So all of you out there, here's what you can expect post-webinar. Actually, let me turn it over to Jacob before I wrap things up. He's going to do a little bit of housekeeping. He'll tell you about some of our free gifts. And for the rest of you, stay on for 2 minutes after. And I'm going to give you a couple quick offers for those that already know they need the help.
Yeah, well, thanks, Terry. Great presentation. I'm seeing a lot of great feedback coming in here from the comments, so thank you for that. With this, the CE is officially over. Just going to give a few quick housekeeping notes here. So as mentioned, I'm getting a few questions. We will be sending out the recording, other resource links. All of that stuff will be coming your way via email in the next 24 hours, so be on the lookout for that. Also, CE credits will be coming your way to the email you registered from within the next 2 weeks. So also be on the lookout for that. If you don't see it, check your junk or spam. It'll be in there. And as mentioned, all things are coming your way. If you do have any questions or you think you're missing out on something, email us at webinar@rectanglehealth.com. We'll be sure to get that over to you. And then please make sure to fill out that survey that pops up at the end. So CE is over, but I'm going to pass it into Terry, who's going to talk 2 minutes about some special offers.
Yes. Before I do that real fast, honestly, from me to you all, means a lot to me to take the opportunity to speak to everyone. For my 600 attendees, I do everything I can to instill the importance and education into you guys. So I really hope you appreciate it. I give you guys my all. Secondly, it doesn't stop here. That culture of compliance, fixing the things that we do, need to happen. So every one of you, my team will give you a call and give you an opportunity to sit down with one of my compliance professionals, not to sell you. They're going to walk you through your risk assessment. They are going to educate you. They're going to make sure you can make an educated decision on what the remedy to your problem is. I don't care if you use our company or if you use another company, but please get compliant and do it the right way. And at least we're educating you so you can go be an educated shopper and do the right thing. And if you need the help, your group and my team will know it. We'll take 5 minutes, show you a little bit of how we can solve your problems. But either way, please make educated decisions. We're here to help. So get your doctor together, sit him down, tell him he needs to carve out 30 minutes for this. And if your doctor does it the right way, it's the last time he needs to pay attention to HIPAA, and the team is equipped to be able to take it from there. So special offer, it's end of month, of course. So for any of you who know you need the help, let us know right away in the comments, respond to the emails. My team will give you 1 free month of our solution, okay? That's $219 off your first year cost. We'll take that off the top. You gotta take action by the end of this leap month. By tomorrow evening, you gotta take action. This is 1 free month of something you absolutely need anyway, okay? And if you have other needs, whether it's how do you integrate your payment solution? Are you sending text to pay to collect, right? Are you doing card on file? Are you doing these things to reduce your AR? Well, my question is how many of that are you still doing manual? Because we can do a lot better by full integration in any practice management software you use. Our payments go in there. We'll collect via text to pay. We do paperless billing. Or whether maybe your team is just manually scrambling to fill those last minute cancellations. Our engagement solution in Bridge Compliance will confirm appointments via text message. Anybody who cancels last minute early, your system automatically has a wait list. It'll contact everyone on the wait list via text message. And while you're sleeping, it'll fill those empty slots on your calendar for you. More money in the doctor's pocket, bigger calendars. There's just a better way of doing business. We're the only place in America where you can get your payments, your engagements, your HIPAA, your OSHA, everything all under one roof. And with that efficiency, we're proven a 2 times return on your investment and a much more efficient business. Our whole mission here is to simplify the business side of healthcare, and we are here to help and teach you how we could do it. So let us help you move you into the future. Let's more automation and spend more time doing the things you love with your patients. So with that, everyone, it's been my absolute pleasure spending the last hour and a half with you. I wish you great success, and me and my team will be looking forward to speaking with you. And thank you so much for all your help, Jacob. Amazing job as always.
Thanks, Terry, and thanks, everyone. Take care.